Hey, let's take a quick listen to this video, then we'll try and entangle it.
We, as the Ministry of Health, are taking all measures to ensure that we protect Kenyans and we protect Kenya from international health outbreaks. And so far, we are dealing with an international public health outbreak for Ebola that is in DRC. As you note, we as Kenyans have a very strong healthcare response system. We are also very strong when it comes to case management in terms of infectious diseases in general. And when we talk about case management, we mean hospital preparedness. We have the highest isolation capacity in the entire country, most of it that have also been built over COVID. In 2015, the country that was relied upon by the world to send 157 experts to help Sierra Leone contain and tackle Ebola from 2014 all the way to 2016. I have even been privileged to be part of the health experts that were in DRC and Rwanda border in 2013, and we were more than 90 of us. All of these are health workforce capacity that no other region, no other country has. So one of the things we want to ensure the country is that we are capable of what we call case management. The other thing is about laboratories. This is our expertise. So this is the time to show up. This is like a marathon has been called in London. Do you say that you're not going to send Kenyans there? This is our expertise. And so from that perspective, we are very confident as a country and as a government that, number one, responsibility is to protect the Kenyan. But as we protect the Kenyan, we can also extend this expertise, we can also extend this experience in the broader global health security response and assist the region, because outbreaks do not care about borders. They do not care about opinions. And you cannot close yourself and say that, oh, us, we are good, we are Kenya, we will protect our borders, and then just forget about it, And if we are to really look at our contribution to One Health.
Whew. How dizzying is this? I mean, what is this? This might be the most exhausting thing you watch on internet today. No kidding, because beyond this Polish language, beyond the confidence, beyond the declaration that Kenya is ready, most Kenyans know and remember something very different. We know because we are the biggest consumers of these healthcare services, and they aren't that great. They aren't that great. We know because we lived through COVID-19 and we remember all kind of outages, from PPEs, oxygen supplies, reagents, medications. We saw overwhelmed wards. We saw patients stuck in a healthcare system stretched way beyond its limits. We experienced exhaustion, burnout. We saw health workers carrying the weight of a collapsing healthcare system on their back, literally, while being called heroes but not being protected like heroes. Those memories are still fresh in us. So, when we are being told that Kenya is ready to take on another global health, public health threat, we got some serious questions. We got to ask those difficult questions, because preparedness ain't a speech. It is not branding. It is not repeating the phrase that we are ready until people stop asking questions. Preparedness lives in those hospitals with no ICU beds and medications. It lives in those laboratories still waiting on supplies. It lives in those wards with too many patients and too few doctors and nurses. It lives in those emergency responses that no ambulances will ever show up. That is where preparedness is measured. And I have to point out there is something very unsettling on who is delivering this message to us. Because the same figure standing behind that microphone assuring the country that everything is under control was once at the center of the longest doctor strike in Kenyan history, a strike that lasted for over 100 days, driven by exactly what we know. They told us they are working in deplorable working conditions. They told us they are understaffed. They told us they are underpaid. They told us their salaries are delayed. They told us there are no equipment and medications, and the list goes on and on and on. But one thing is for sure, doctors did not stay out for over 100 days over nothing. They were protesting conditions in Kenya's healthcare system. The conditions that they said, or they told us, they are unsafe for both health workers and patients themselves. So Kenyans are justified in asking what exactly changed. I'll go first. Nothing changed. Maybe someone was bored. Other than that, nothing changed. But you might want to ask yourself if hospitals were this unsafe to trigger such a historic nationwide strike, if our health workers had to fight that hard to be heard, then in what basis are we now being told we are among the most prepared? And if major improvements have happened, we haven't seen them, we don't feel them, but please let us know. Show us the numbers, show us the staffing, show us the stockpile, show us the county level and national level readiness. Show us those the isolation capacity beyond that policy document and podium statements. Also, show the front line because they are also a little bit confused. And as you know, frontline workers usually know the truth way before press conferences do. But one thing I have to agree with you, there is no question on the dedication of Kenyan health workers. If anything, they are the reason why this system survives error. They continue to show up despite the challenges and the strain they face every day. But asking Kenyans to trust sweeping declaration of readiness without addressing the very glaring failures across Kenyan healthcare system, we got a problem with that. And that is where trust starts to fracture. Because Kenyans aren't asking for perfection, they're just asking for honesty. And just so you know, Kenyans aren't stupid. They do know the difference between country reassurance and political messaging. Again, for sure, 100%, Kenyans health workers are resilient, but resilience should not be mistaken for system readiness. Those are two different things. If another pandemic were to test this system tomorrow, it wouldn't be the speech to carry the burden. It will be the nurses, the doctors, the public health officers, the clinical officer, the lab team, the support staff, again, as they always do. So, before you declare to the world that Kenya is ready to absorb another global health responsibility, you owe Kenyans an honest answer to a simpler question: is the system itself truly ready, or are the workers expected to carry it again? Please let us know. We are curious, and thank you so much for your attention on this matter. Bye.